might see. So one of my favorite ways of explaining things to people is the way that they've made chemotherapy to attack the tumors is basically the tumor is a rapidly dividing cell. It abnormally grows, and so the chemotherapy is meant to attack the rapidly dividing cell and kill it or prevent it from growing further. But then we see these side effects because there are other normally rapidly dividing cells in your body that it inadvertently affects as well. So we have our skin cells are rapidly dividing, so sometimes you can have issues with like dry skin or minor pigmentation changes, or sometimes maybe a rash. So that sometimes is an issue. Your GI tract, so sometimes you can have like issues with nausea, vomiting, diarrhea, constipation, things like that. Your hair follicles are also rapidly dividing, so that's why sometimes you'll have hair loss. And then, so also your bone marrow. So that's why you'll see like a decrease in your white blood cells and sometimes your red blood cells and platelets. So that puts you at risk for infection. So that's why some of the hallmark signs from chemotherapy, which I find helpful to kind of like picture. So more so white blood cells, sometimes you'll have lower red blood cells and platelets. And if that's the case, you can get signs of, anemia, as far as fatigue, sometimes even shortness of breath. Usually we'll see that in your labs before you start feeling that, but if you do feel that way, let us know. And we'll be checking your lab values every single time you come in.
Sure.
So first thing you get here, we'll check your labs. And then by the time you see Dr. Picozzi, or sometimes you'll be seeing Soumya, our nurse practitioner, and then they'll have your results. They'll review all your results and make sure they look okay before they clear you to get treatment.
Gotcha.
Because sometimes, so essentially, every time you get chemotherapy, your counts do kind of a dip here, and then they'll come back up. And we just make sure that they're up high enough again before we give you another dose of chemo and you go back down. Because, if they haven't come up enough and we give you another dose, then they can drop too low. And we don't want to skip chemo if we don't have to, because we want to,
Right.
stay on track and keep fighting the cancer as much as we can. But we also want to make sure that we're not, that we're allowing you enough time to recover. And sometimes you just need an extra week or so. So sometimes they'll have to just push off chemo a little bit, but we try and avoid it if possible.
Is there anything I can do, like eating well or exercising during chemo? Is it pretty much life as normal, or?
Essentially, yeah. I mean, you want to make sure you're getting enough nutrition in general, just because we'll kind of go into it more, but it seems like a lot of people have issues with loss of appetite, whether it be from nausea, or sometimes it's just taste changes. Like sometimes people can get a change in their taste buds. I think with the Florida cells, sometimes they'll complain of a metallic taste when they're giving you that push. And things like that just can, make you not want to eat as much. And so some people, if you're not getting enough vitamins and nutrients.
And then there's mouth sores some people get as well.
Yeah, so, essentially, one of our ones, mouth sores. So sometimes because the lining of your mouth is also susceptible to the chemotherapy, similar to the GI tract lining and things like that. Just mostly we see it with the 5FU, the fluorouracil, because sometimes you do that more often. And so, that can sometimes, if it gets to the point where it's uncomfortable, it can sometimes affect your food intake. So one thing about that I really like to point out is the best thing for that is just prevention. So preventing it from ever getting to the point where it's affecting your food intake or causing you pain or discomfort. Because once it gets to the point where your sores are that uncomfortable, it's really hard to get get it back.
And there's a prescription I know people take. It's for thrush or something that seems to like get rid of it immediately.
Yeah, so you can get thrush, which is a fungal infection, and so sometimes just because you're more susceptible to infections or just certain I think certain times when your mouth is a little bit more at a vulnerable state, it seems like people are at higher chances of developing thrush. But sometimes it could be mouth sores without the thrush as well, and just kind of like canker sores.
Gotcha.
So yeah, if it is thrush, we definitely have antifungal.
My sister Kathy said that when Jerome had his kidney transplant, he got thrush, and she said she got just a regular canker sore and took one of his pills for that. She said literally the same day the canker sore was gone.
Wow.
Yeah.
Interesting.
It's crazy. Yeah.
Yeah, so yeah, if it is like thrush, we'll give you like, it's called nystatin, or I think there's a pill form as well, but it's like a liquid that you swish around and
that's
so
what
that'll
she did.
get rid of it. Yeah, but like if it's just just the sores, there's a couple different ways to treat it, but I mean most of the time it's mostly treating the thrush or just trying to take care of it and let it heal on its own. But we have a lot of medications we sometimes do, like we have magic mouthwash, which is essentially like lidocaine with Benadryl and a couple other medications like mixed together. So it helps with like more symptom relief, but it also can help it heal. But I like to try and prevent it from ever getting to the point where it needs medication. So just using like soft bristle toothbrushes, avoiding like really harsh acidic or spicy foods, and just being really hyper aware of how your mouth is feeling and the health, the health of the lining of your mouth.
Sure.
And then if you ever start to have issues, or sometimes just right off the bat, another one of our favorite treatments is the baking soda mouthwash. I don't know if you've ever heard of that, but it's about a half teaspoon of baking soda, half teaspoon of salt, and warm water, and you swish it around after meals and at bedtime, and it really just helps protect the lining of your mouth and fight off any irritation that, like, if you're starting to have the beginnings of what it kind of feels like, maybe irritation. That's a really good way.
As a child, I haven't done that for years.
Yeah.
So we're doing it,